Hi guys, welcome back to my channel 32 Happy Teeth. Today we are going to study Addison's disease. So let's start the video. Addison's disease is also called as hypocortisolism. Addison's disease is because of adrenal insufficiency. So basically, adrenal insufficiency is divided into two parts. One is the primary and the other is the secondary. So the primary adrenal insufficiency, its reason is that if the adrenal gland is reduced in size or if it becomes non-functional. So primary adrenal insufficiency, it constitutes about 80% of the cases, whereas secondary constitutes only 20%. And secondary, what's the reason for secondary adrenal insufficiency? It's that if the inability of pituitary to secrete ACTH, like if the pituitary gland, if it doesn't secrete ACTH because of any reason, then there will be secondary adrenal insufficiency and it constitutes only 20% of the cases. So now coming to the primary, so what happens in primary, that there is increase in ACTH. So of course, if the ACTH increases, there will be decrease in all of the cortex hormones, because ACTH, it controls cortex hormones. So what are those? That are cortisol, aldosterone and DHEA. So all these three hormones will decrease its concentration. Now, ACTH is responsible for melanin pigmentation. So, if ACTH increases, there will be hyperpigmentation. Okay. Now, we also know that in my previous slide, I have told you about the physiology of adrenal gland. In that slide, I explained you how aldosterone helps in the reabsorption of sodium and water, whereas secretion of potassium and H plus ions. So, if aldosterone concentration decreases, it will lead to hyperkalemia. Why? Because it won't be able to secrete potassium in the urine, and it will also not be able to reabsorb sodium. So there will be hyponatremia and hyperkalemia. Now moving on to the secondary adrenal insufficiency. In secondary adrenal insufficiency, there is decrease in ACTH, whereas increase is in primary. Okay, so when there is decrease in ACTH, in this case, there will be decreased cortisol and decreased DHEA. Why? Because it is under the control of pituitary gland. Okay, since cortisol and DHA are under the control of pituitary gland, so it will also decrease, but aldosterone will remain normal. Why? Because it is under the control of RAS, that is renin-angiotensin aldosterone system. Okay, since ACTH is decreasing, there will be no hyperpigmentation, and of course if the DHA will decrease, so DHA, what does it control? It controls our libido, then it is responsible for our axillary hair and pubic hair growth. So of course the axillary and pubic hair growth will decrease, that it will become sparse, and there will be decreased libido. Okay. Now we know that in primary Addison's disease, there is decrease in concentration of all the three cortex hormones, that is cortisol, aldosterone and DHEA. So one by one we will study all these hormones. So if there is decreased cortisol level, what will it lead to? It will lead to fatigue, tiredness, loss of appetite, hence loss of weight. Then of course if cortisol is decreasing, so there will be hypoglycemia as well as hypertension. Now if there is decrease in the concentration of aldosterone, so what will happen? Because aldosterone is decreasing, so there will be loss of sodium and water. Why? Because aldosterone will not be able to reabsorb sodium and water, hence leading to hypovolemia as well as hyponatremia. Now what will this lead to? It will lead to orthostatic hypotension. Now since aldosterone is decreased, and so it won't be able to secrete potassium in the urine, so there will be hyperkalemia. And of course, since there is loss of salt, so the patient will have this salt craving and there will be dizziness. Now coming to the third hormone, which is DHEA. So when DHEA decreases, it will decrease libido and it will also decrease body hair. Now there is also increase in ACTH. So if ACTH is increased, there will be hyperpigmentation of skin and the mucosa, but the tongue will be spared. So this point you should note it down. Now coming to the metabolic findings seen in Addison's disease. So what have we studied before? There will be hypoglycemia, there will be hyponatremia, there will be hyperkalemia and hypercalcemia. So this question, that is there will be hypercalcemia, it has been asked in one of the NEET MDS exams. So you should remember this very well. Now coming to the screening part. You will call the patient before 8 a.m. and at 8 a.m. you will check the patient's plasma cortisol levels. If the plasma cortisol level is less than 3 microgram per deciliter, then the patient is suffering from adrenal deficiency. And what is the normal concentration of cortisol? That is 20 microgram per deciliter. But if the values are between 3 to 20 microgram per deciliter, what will you do? You will go for another test, which is ACTH stimulation test. And how will you stimulate ACTH? By administering IV or IM 250 microgram ACTH. After 1 hour, you will again check the plasma cortisol level. And if the value still remains below 20 microgram per deciliter, then the patient is confirmed that he or she is suffering from adrenal deficiency. So for the treatment of Addison's disease, we prescribe steroids, particularly fludrocortisone, and it is given in 3 dosage, that is of 10, 10 and 5 mg. So the first 10 mg dose, it is given at 8 am, and the second dose of 10 mg, it is given at 1 to 2 pm, and the third dose, which is the 5 mg, it is given at 4 to 5 pm. Now moving on to the acute adrenal crisis. So what are the reasons which could lead to acute adrenal crisis? There are basically 3 reasons. First is if there is rapid tapering of steroids. That is, if we rapidly taper the dosage of steroids which we are prescribing to the patients, then it can lead to acute adrenal crisis. The second is that if there is non-compliance to steroids, that is, the patient is not responding well to the prescribed steroids. And the third is if there is increased stress level in Addison's disease patients. So all these are the 3 reasons which can lead to acute adrenal crisis. So what are the signs which you will see in these patients? It is that the patient will shout with acute gonial pain. It will be so painful for the patient that he himself will ask for steroids. There will be acute abdominal pain. There will be vomiting, circulatory failure, hypertension, as well as hypoglycemia. So how you should treat a patient with acute adrenal crisis? So as soon as the patient comes, you need to administer 3 liters of NS to the patient. After that, you have to start hydrocortisone IV for 3 days. And after the 3rd day, you have to taper to oral dosage. So this is how you need to tackle the acute adrenal crisis patient. So this was all about Addison's disease. If you want to learn about the physiology of adrenal glands so that you can better understand this particular video, you should watch my previous video, which is physiology endocrinology. You will then have a better understanding of how this Addison's disease is, and how I will also make videos on Conn syndrome, Cushing disease. So it will be much better for you to watch the previous video, which is of adrenal gland. So this video will be available in PPT form on my Telegram group, which is 32 Happy Teeth. I will provide the concerned links in my description box. You can also follow 32 Happy Teeth on Instagram by the same name. I also have a Facebook page. You can go. I continuously update on both of these channels, that is on Instagram and Facebook. And if you have any doubt regarding this video or any other video which I have posted on my channel, feel free to ask in the comment section. I'll be very happy to help you out. I hope you liked my video, and if you do, so please hit the like button and share it with your friends. And don't forget to subscribe to my channel, and also please hit the bell icon. Thank you. Have a good day. Bye bye.